One of the most important organ in our body which helps us for healthy aging is muscle. Hi, I am Dr. Moumita, general physician from Hyderabad. So, what we think whenever we talk about muscle, we think about muscle building, bodybuilders having more protein, but what we don't think about how much is impact on other general health. So let us discuss about that, except that aesthetic part or good looking part or any other bodybuilding part. First important is muscle act as a glucose absorber. So what happened is normally whenever we take food, the sugar levels goes up, insulin gives signals and there will be some receptors in our cells, the GLUT4, where the insulin will bind and then it will transmit, it will allow the glucose to go inside the cell. What happens in type 2 diabetes or what happens in insulin resistant cases, that the receptors will get resistant. So how much of a sugar is much more, and because of that pancreas is secreting more and more insulin, but glucose is not going inside the cell. That is the main pathophysiology for the diabetes or insulin resistant. How muscle can help or how muscle can improve in that stage is whenever after food, when we walk or any other time when we walk, when we do exercise, muscle will have the same GLUT4 receptors which will be not depending on insulin. So as we eat, it just absorbs the glucose because it needs more and more energy. It is active. So that's the reason even if you take a gulab jamun, you can walk for 15 or 20 minutes. Your sugar spike will be much more lesser than the other time. So that's first. Second thing, it improves our, and obviously whenever you are exercising for a longer time and you are slowly growing your muscle, the number of the muscle will increase. So there is something called basal metabolic rate. So even if we are sitting, we use a very minimal calorie. When we are sitting for a longer time and if we have a good amount of muscle number or muscle fiber, our basal metabolic rate will be little more higher. So our body is consuming much more calorie than a person who is having less muscle. So that's the second important. So even if you are sitting, you can increase or you can spend more calories. Third comes to neuroplasticity. Whenever we are exercising, there will be some chemical which comes from our muscle, like something called BDNF, irisin, interleukin 6. Those will make our memory much more better. So that's why it's seen the person with aged also, their dementia level will be much lesser who does exercises than other person who is sedentary for a longer time. As we know, it improves our metabolic health also, and muscle will improve hormones also. So we see the number of SHBG also will be improved, testosterone numbers also will be improved. So many people who are suffering from infertility or fertility issues, after exercising they improve that. So these are the other thing than thinking about the only aesthetic part. Let's see about what kind of muscle we have. So there is something called slow twitching muscles and something called fast twitch muscles. Okay, that means there is something called type 1 fiber muscle, there is something called type 2 fiber muscle. Type 1 fiber usually we use for endurance, for a long run, for a yoga, posture stability, we use for type 1. Type 2 muscle, as again two types, one is type 2A and type 2X. Type 2A is a intermediate type, so that is very much trainable. So like when we climb the steps in that kind of thing, or for sports we use more of a type 2A. Type 2X is when we run, when we do HIIT exercises, high intensity exercises, when we need immediate energy, that's when the type 2X is required. Now why I am saying all this thing is, as we know, as we age older, after 35 or 40, every decade we are losing around 5 to 8% of our muscle fiber if we are not trying to protect it. So first thing is, how much ever we are having, we need to preserve, and then we have to think about increment. So when we are losing that, after the 60s, the number of muscle loss will increase, mostly that type 2X. And what will happen if we are losing our muscle fiber? our balance will become imbalanced. The number of fall increases, will become friable, will get multiple time hospitalized. Another thing is our immunity also become low, because with muscle fiber or with increased amount of muscle, as our balance will improve, at the same time it act as a protein reservoir when we are sick or when we are old. So if you had a surgery, you had a trauma, or after any infection, a person who is having a healthy muscle weight, they will recover sooner than the other person. The days in the hospitalized will be less. So these are the reason that we need to be more focused on not only about the bodybuilding part or aesthetic part. Now, how can we improve? As we know, whenever we are talking about muscle, we need to have more of a protein. Especially, we need to have tryptophan and lysine. These two are important. Lysine is much more important. So, how much we need to take protein is 1.2 to 1.6 gram for a normal adult. A person who is more than 60 who want to preserve muscle, for them requirement increases from 1.6 to 1.8 also. A person who is athletic, trying to build much more muscles and trying to do much of our exercise, for them it can go up to 2 or plus. But definitely we need to be careful if you are having any kidney issues, your liver issues and any other chronic diseases. We need to be better consult with a nutritionist or a physician or your doctor before you started taking care by your own. Now, along with numbers of protein, numbers of grams of protein, it is important how is the quality of the protein. So as we know, complete protein we will get it from the non-vegetarian, but yes, vegetarian protein also when we will mix, then we will get a complete protein. Like when we mix rice with dal, we get a complete protein. We mix soy with millets, we get a complete protein. So we can mix and you can get a complete protein also. So diet is important, exercise is important, and along with the exercise, we have to do recovery. When we recover, when we sleep, that's when our hormones come in action. So growth hormone that will help for muscle protein synthesis. Okay, and if whenever we sleep, we take rest, our cortisol comes down, and when our cortisol comes down, and we get much more recovery time. So stress is another part that will lyses the muscle. So whenever we are taking a proper rest, our growth hormone releases other hormones like IGF-1, all those hormones will release and it will help for the muscle growth also. So muscle is not only for just look or not only for show off, it is a base. It is to protect ourselves, it is to protect our independence after 60 or after 8 years of age, so that you won't be dependent on others. Your muscles, your bones will be strong, you will have a good immunity, you will have a good sugar control, you will have a good metabolic control. So we can live our life as we want, not on depending on any other person. So protect it, preserve it, and go for a good future. Thank you.